But it's clear that we haven't been to all the SEC schools, but the ones we have been to, including this school, have really spent the spring and summer planning in a comprehensive way. Planning for how they would care for students once they became positive, how they would care for those who needed to be quarantined due to exposure, how they were going to expand testing. And I think what has been really encouraging to us is to really see that they not only planned, but they also have been meeting regularly to adopt and modify the plan based on the needs of the students and their findings. And I think based on the data that they're collecting. And I think that's what's really critical, to not only have a plan, but a way when you're collecting data and you're seeing an issue that you have a way to address it. It's clear that they have a strong testing plan, quarantine and isolation plan, and support of the students. I think what we were excited to hear about is their comprehensive approach to surveillance, utilizing testing starting with wastewater and then testing whole dormitories with pooled saliva tests. This is exactly what we recommended several weeks ago in the governor's report, and so we were excited to see that plan out, as well as some additional random testing, both as identified by the wastewater, but also random testing of different living styles that they have here to make sure that they really have good eyes on this asymptomatic and asymptomatic spread. I think what we want to make sure in all of the campuses, we've seen, and we always get here early so we can drive around the campus and see what's happening. We did see excellent utilization of masks by students on the campus. We want to make sure that that same activity is happening out in the community with students, but also make sure that community members are also wearing masks that are part of the Knoxville community. And so we had an excellent meeting with not only the school staff, but the mayor of the county and the mayor of the city and the local county health officials to really talk through a lot of these issues about how important it is not only for the students to mitigate, but the community members to continue to mitigate. To just remind every citizen that we know now that a lot of the transmission, and I know a lot of the outlets have really picked up on the CDC's discussion of restaurants and the spreading that could be happening in indoor dining. But what they didn't pick up on is the fact that what that article really points out is the majority of the spreading is happening in family gatherings and neighborhood gatherings, independent of being in a restaurant or a bar. What was encouraging about the study is retail alone, going shopping, being out, going to malls, was not associated with any kind of significant spread. And so just to remind everybody in the community to, instead of saying socially distance, we're going to say physically distance while you're working through and having social activities. Because we really think it's important to emphasize what can be done, not just to talk about what can't be done, and to really assure the American people and the people of Knoxville and the people of Tennessee that there's a way forward together if we all wear our masks, physically distance while we interact socially, and really ensuring that if we're going to have an event in our families and in our neighborhoods, they're going to have to make the assumption that everybody is not negative. I know people want to believe that their family members could not possibly have COVID, but we know that there's a lot of asymptomatic spread. And so you really have to make the assumption that someone in that party could have COVID, and you need to really maintain your mitigation. We don't want double standards. We don't want excellent student activities as far as mitigation of mask wearing and physically distancing on campus, and then a sense that once they're in the community, there is a different activity. So really working with the community to make sure that students and community members are doing the same masking and the same physical distancing. The other thing we talked about is I think all of you know there was a serious outbreak across the South due to vacation patterns. A lot of that virus over June and July moved north into Kentucky and Tennessee. We are seeing some progress across Kentucky and Tennessee. But we also want to see increased testing. We've seen testing decrease in Tennessee and a bit in Kentucky, and we would really want those tests that are no longer utilized in emergency rooms and hospitals to really be utilized to work with the community to do more testing to ensure that they can find asymptomatic cases. At the same time, last week we completed all of the deliveries to long-term care facilities to make sure staff are regularly tested. So we talked about to the mayors and the county health officials really about going into the fall, having really active surveillance, whether it's routine testing of K through 12 teachers, whether it's routine testing of all the staff in assisted living and senior centers and long-term care facilities, consistent testing of all the staff in prisons, to really have eyes on the community about the level of asymptomatic spread. We think that's going to be really critical going into the fall. We can't rely on symptoms as our sole indicator that we have cases circulating in the community, as we know that probably half or more of those cases, and if you're a young person, way over half are asymptomatic, and we want to pick up both asymptomatic and symptomatic spread. So the university is doing a great job with symptomatic testing. They are working and setting up surveillance for asymptomatic testing, and we're just asking states and communities to do the same thing, to really understand how they're going to test both in the college campus, which we think they have a great plan for, but also in the community to find asymptomatic spread in the community. As we know, that was the primary driver of the outbreak in the South, and we also know that was the primary driver as people went on vacation to beaches on the South and brought that virus back over the summer. And so although we see improvement across the country, particularly starting with the South, we do see virus moving up through the Midwest, up into the upper Midwest, and we still see virus moving into Kentucky and Tennessee from the late vacation patterns of August. So I'll stop there and see if there's any questions. That's a great question. So we talked through, we've written a governor's report every week. There's one coming out this week. It will be report number 12. In this report, we decided to bring together what governors and mayors had done across the United States to mitigate this last transmission. And they have done all of those things. Some local communities and some governors closed bars completely, as Arizona did. And as several other states did, including the Miami area. Others not only created curfews for ending liquor sales, but it made it clear that there could be no liquor consumption after 10 p.m. or 11 p.m. And they thought that was key, not just a curfew, but decreasing liquor consumption so that people would not order a lot and then stay drinking after 11. So there couldn't be any alcohol drinking in bars after 10 or 11 o'clock. What's really important is the community knows where they are with test positivity and cases. And they can then determine, is their mitigation effort working, or do they need to change it? And as long as cases and test positivity are going down, they can make the assumption that what they're doing with masking and physically distancing and this curfew on the bars is working. But when cases go up or the test positivity is stalled, if any of those are happening, then they really need to reevaluate all their mitigation procedures. And if they need to increase them, they need to know what they're going to do with each step. And that is something we talked about, not only knowing where you are today, but knowing precisely what your next step would be. And I think with the SEC schools, I'm very confident that the students are really working together to mitigate. What I'm always worried about is what happens when the alumni and parents come during a game. And I think getting letters out to them proactively and saying, these are our expectations, and really ensuring, I know those parents and alumni will be excited about seeing each other because they haven't seen each other for the last 6 or 7 months, really figuring out how we physically distant while maintaining social activities and being able to find places where that can happen and laying that out. So we talked about closing streets, expanding outdoor dining, and all of those kind of options. Well, to every student that's not following those rules, what you're creating is super spreader events. And we know those are. We know that that's happened in community after community. We don't want it to happen here. And so really calling on every student, it's a responsibility to be in college. I know it's also a freedom to be in college, but no matter where we are in our life, we have both freedom and responsibility, and I think every student needs to understand it's their responsibility not to participate in super spreader events. And I think that's hard on everybody, but I think we can get through this together by knowing this is a short-term sacrifice we're all making for our future together. Yeah, we talked about that on both ends of that, really, to understand if a student is deciding to go home to quarantine or to isolate, someone really needs to work with that family to discuss the risk. There's very clear guidelines on the CDC website about what to do if a family member is positive, and I think every family member ought to assume that that student is returning is positive until they're documented that they aren't, and so there's very good guidelines for that. We also talked about figuring out a way to test students before they went home for Thanksgiving and really talking to students for those last 7 days that they're in school, really being careful about these kind of activities because I know they're going to want to see their aunts, their uncles, their grandparents at Thanksgiving. And the last thing I think they want to do is spread virus to them. And let's face it, most of those indoor gatherings will be indoor at that point, and it'll be very difficult to have a mask on and eat turkey. So really figuring out physical distancing and really figuring out the social responsibility that each student needs to take to ensure they don't bring virus home, and then also to ensure they don't bring virus back to campus. I think there's three things, and that's an excellent question. The first one of it is, remember about 80% of students, no matter what university you're with, have off-campus housing and are off-campus, and really ensuring that there's surveillance activities for the students who are off-campus. And I want to really applaud the students who are coming forward and getting tested, because that's the way we can figure out where the virus is. But the second thing is we also talked to the university about really working with the students to do serial testing for people who are in quarantine. Because a lot of our data is from the March-April timeframe, and we really want to know, do students have to quarantine for 14 days? And really, I think the university has a plan to really evaluate and research this. Because I think if we can come back to students and say, it's really this period of time and we have the data and this is why we're doing it, becomes critically understandable, and students are much more willing to comply. And I think all of the students can be part of that solution, not only for University of Tennessee, but for the whole SEC schools. Third, we think the most dangerous thing is to close a university or stop having classes, because then you have no eyes on students. And I think the in-person classes, the way they are socially distanced in this university and every university we've seen, is remarkable. I just want to say the planning that the SEC schools did to really ensure that every classroom was set up to protect the faculty, social distance, physically distance the students, is really quite good. So I'm confident that a large number of students are not being infected in the classroom. And so we believe that keeping those resources and the support in a university that's used to supporting students, I know this is a difficult time and an unusual time, but universities know how to support students through mental health issues, through anxiety, through academic workloads. The worst thing you could do is have a student feeling even more isolated, which I think online classes do. So having a hybrid, having a mix, critical. Once universities have brought students back to campus, the most dangerous thing they could do is close the university completely and go to online. because then you have both the 70–80% of students that are in all-campus housing who are not returning home. They rented that space, they're staying in that space, and now they're not linked to their friends, and they're going to create other kinds of off-campus gatherings. And so we're here to both hear the plans, really talk through the plans, which we think are extraordinary and strong, and most importantly, data-driven and willing to adapt, and really focused on both protecting the students and the community. And that's been really very important to see. Yeah, I think we have to remember that people have been at this for a very long time, so there's a lot of fatigue. And so the very important part about public health is finding out a partnership with the community, because they're the public and they're the part of health. So when we're talking about the behaviors that we need to have and expect, we really need to talk about why it's important and what we're asking people to do, and really work with the community and have that kind of discussion, both with the retail establishments, but also the community itself, and say, this is what we need to do for the next 2 weeks, or this is what we need to do for the next 4 weeks. And this is what we're going to do next if we don't see the cases improved. And so I think it's really important to lay out the entire plan, and so that people know not what's going to happen next week, but what's also going to happen 4 weeks from now if the cases go up or the test positivity goes up. And then I think you bring people with you because they understand why they're doing this. And I think that's what's really incredibly important. When we shut down the country, across the country, we didn't know that the epidemic was going to be very isolated to the Northeast, Chicago, Detroit, and significantly large metros across the upper Midwest, New Orleans, and the Northeast. And I think for the individuals who were here and didn't see a big problem in March and April are a little disillusioned with our mitigation efforts. And I think now we have to bring them along and say, yes, we understand that in March and April we did this, and we really didn't have a problem. But now we have this problem. And so we want to do these things together, because it doesn't help to put out an edict that people aren't going to follow. Because if you drive people underground, then you can't see the behaviors, and then you can't even tell that you're at risk. So what we have done with the governor's report, and I'm really excited about this week's governor's report because what it includes, we've been to 28 states now. We've been on the road since about 30 June. And it's really been extraordinarily valuable. And I want to assure both the people here in Knoxville and the people across Tennessee, every governor and every mayor I have met has been focused on really protecting their community. And that's been very encouraging. But what we've compiled in this week's report is a real understanding of what governors and mayors have done that's worked, so that every governor and mayor around the country can look at this and say, oh, okay, I can do this and reevaluate. What's really important is you do the mitigation that we know now is successful, and it's a combination, all starting critically with us wearing masks, and that when we don't have masks on, we are strictly physically distanced, even if we're with family that we're not living with or with neighbors that we don't live with. And so really that physical distancing is key. And then depending on where your cases are, decreasing indoor dining to 50% had a significant impact. Increasing outdoor dining also significantly mitigated new cases. But this whole bar question and standing bars is really critical. And I think that's what the county really needs to look at and look at carefully. And depending on what the situation is and what the cases are, to make the decision about what they're going to do next. Is it enforce the curfew, as you said, they may not be enforcing? Is it about enforcing that last alcohol consumption needs to stop at 10 p.m. and no one can be drinking in the bar after that? All of those things have to be considered. But what we have found is the local officials do know their community the best and really needs to find that path forward that the community and they can come together on. Because if you make a restriction that the community won't follow, then it doesn't help to mitigate. So really finding where that dialogue is. But to everybody in Tennessee, we can make even more progress together if we all wear our mask. I know some of you believe you live in rural areas. I can tell you that the virus is in rural areas and urban areas, and the virus is infecting Republicans and Democrats and independent equally. This is not a political issue, and we all have to mitigate together. You know, I think that's why retail is so important. As we've traveled across the country, we've seen a lot of people moving around. And the reason these mask mandates, either locally or statewide, are important is because it's the retailers then reinforce that message. And so we've seen across this country, whether you're in Oklahoma, or you're in Iowa, or you're in Louisiana, or in Tennessee, when the retailers post no mask, no entry, it reinforces that behavior. And I've seen so many people at every gas station go back to their car and get their mask. And so it is breaking through. And I think as long as your retailers, particularly your gas stations, are enforcing that, it reminds them all the time that that's the level of expectation. Now, we probably have been in 40 or 50 hotels, and we've been in 40 or 50 restaurants, and we've been in every Starbucks in every single state across the Starbucks enforcing social distancing and physical distancing. All of these places are doing their part, and I think it reminds the citizens every day that they need to do their part too. Thank you so much, and thank you for your work that you're doing.